the first aesthetic treatment beyond the cavities and beyond the classes. We learned until now how to do class 1, 2, 3, 4, 5. And now we're going to talk about how we can close a diastema. Let's first remember what causes diastema. What are the reasons behind the diastema? Do you know? Flossing a lot between teeth.
Periodontitis.
Periodontitis. Okay, periodontitis, it means we have a loss in the soft tissue and then kind of bone resorption. That's why the tooth could drift and cause some spaces between the teeth. This is what we mean by diastema. Other reasons: missing teeth and the drifting of the neighboring teeth. What else? Big jaw, small teeth, right? This means that we have spaces between the teeth. So why it is important to understand the reason behind diastema before the treatment? Because sometimes the diastema is caused by a frenum, low attached frenum. Do you know the frenum, the labial frenum? Yes. If the attachment is between the two central incisors, the movement of the lip will cause the drifting of the teeth and the space. So if I close the diastema with composite and the frenum still in the same area, after a few months, the diastema will happen again. So first of all, I have to understand the reason, then to do the treatment plan. So in the case of frenum attachment, I have to do frenectomy. I will remove the cause first. I will extract exactly this mechanical pressure over the teeth. So I will do frenectomy, and after frenectomy, I can close the teeth with composites. If the reason is missing teeth, I have to evaluate. Let's say we have missing lateral incisor, and the missing in the lateral incisor cause drifting between the centrals and the spaces. I have to evaluate the whole mouth and put a treatment plan that is suitable to replace the lateral incisor first, then the diastema. Like if I can do orthodontic treatment and align all the teeth and keep a space for the lateral incisor to do implant later, this is a choice. But at the end of the orthodontic treatment, do I know if I still have diastema or not?
No.
So we have to do planning, and now it is done by digital planning, simulate the movement of the teeth, and at the end you can see if you will have a diastema problem or not. And you can evaluate the three-dimensionally the area of the implant. Let's say if the reason of the diastema is microdonty, which means smaller teeth in a big jaw. This means that the diastema is present between all the teeth. So, is this case going to be suitable for composite?
No.
Why?
There's so many gaps. We need orthodontic.
Many gaps?
Orthodontic treatment.
Orthodontic treatment? Veneers. What else? Here, can you imagine small teeth, microdonty, with big jaw?
Maybe surgery. Jaw surgery.
In this year, not in this year, in the fourth year, we're going to talk about the basic principles of aesthetic treatments. And there we're going to talk about something that you all know, which is the golden ratio. You know the golden ratio, right? You heard about it.
Yes.
Which means that each organ in the body is created according to proportion. The length in proportion to the width. And the teeth are the same. We should have specific ratio between the length and the width for each tooth to be in harmony and to give the aesthetic appearance, okay? So in the case of microdonty, teeth are very small and the jaw is big. I have then to decide to achieve good aesthetic result. How much should the tooth length will be and the width could be? And accordingly, I will do the design. And according to the design, I can understand if I need first crown lengthening procedure or not, gingivectomy procedure or not, or orthodontic alignment or not, or maybe just I can close these diastemas with composite, or I need to do full crowns or veneers. So the options of the treatment will never be random. You should first all understand the reason behind the problem, then how it affects the neighboring teeth with a full comprehensive treatment approach, then do design. Designing is very important. Imagine what is the end result of your treatment, then you can take the decisions and do your treatment plan. You will present your treatment plan to the patient with all the choices and the patient will choose. Don't be surprised if patients sometimes accept the intermediate result, not the perfect result, to avoid payment or to avoid visiting the clinic more seances, or sometimes just to avoid consuming long time procedures like orthodontic treatments. You will find a lot of patients accepting cutting the teeth rather than orthodontic treatments for 2 years. So the treatment decision is a long journey in your mind, starting by understanding the reason. I have to understand this is a frenectomy case. Is the frenum is the reason of the diastema? Is it the microdonty? Is it the missing teeth? Is it just diastema between two centrals and the other teeth are perfect? Is it after breaking the edge of the tooth? I should understand that. Then I should understand what is the effect of the diastema on the other teeth. If my treatment will be affecting the other teeth or not, then I will simulate. How can I simulate? Simply by taking photos, using software programs, or sometimes by freehand mock-ups, like what I'm gonna do now, okay? Then you will present the results with the treatment procedures, with the approach, with the treatment plan to the patient, and then decide. In the cases of the diastema, we have several things to think about. First of all, I have to respect the golden ratio. Why? Because if I'm doing this treatment for aesthetic reason, I don't want to end up with very wide teeth, central incisors, right? The patient will not be happy. So if the length of the central incisor is 11 millimeter, according to the golden ratio, the width should be again
60.
no 60%. You mean 60% of the 11, it means 9 millimeter. This is the percentage proportion, or 1.69. I'm sure that you are asked about it in the exams. So first of all, let's measure. Let's say the reason behind this diastema is just space between the two central incisors and the other teeth are perfect, like you can see. So my choices could be between veneers, composite restorations, and I will check that by understanding the proportions. Let's take a periodontal probe. I will measure this. By the way, here is the cemento-enamel junction. And I will try to show you the cemento-enamel junction here. Okay. And here is the cemento-enamel junction for the lateral, for the other central incisor. Okay? So, the length is almost 11. But here the width is 8. Here the width is 12. Again. No, this is, can you see well? Here, this is 10, not 11, 10. 10. And this is 8. So this is 10, 8. Let's write. To 8, and this one is 10 to 11. So the width here is much. We talked about the ratio 80%. So first of all, I have to think that I should do the two teeth similar to each other. And I should check the space between the teeth. Here, the space between the teeth, here it is 3 millimeter at this side and 1 millimeter at the incisal edge. And I have little space between the central and lateral. It is about 1 millimeter plus 1 millimeter. So I have to think to make the two teeth similar to each other and to keep the midline in its place. Here is the midline. So you can see that the midline is contacting the incisal edge of the right central incisor, right? Here is the midline. So if I want to make the left central incisor similar to the right one, I have to increase the width. Here we said like the width is 8, but here it is 11. So I should add like 3 millimeters more, 1 millimeter from the mesial, and it should be like 2 millimeters from the distal, right? This is an option. And make the length the same, 10 to 10. But let's think first, is this proportion right?
10 to 11.
No. With the calculator now. If the proportion is 80% and I have a width which is 11, how much should be the length of the tooth?
10.
11 times
10.
11 times 80 divided by 100.
Should be 8.
Calculate.
Yok.
55 bölü 4 kaldı.
10 multiplied by 8. 17.
Ah, you want 10.
Do you remember this?
Değil mi hocam?
11 80 bölü 100. Evet. So I'm looking. No, guys. No, guys. If I don't want to change the width, I want to change the length.
Ben
Ters.
onu mu? 10 mu olması?
Aynen.
O zaman 8 olur.
8 oluyor.
Hayır.
13.75 oluyor.
13.75.
Onun
It
4 bölü
means-
5'i değil.
Nasıl hesapladık? Evet.
Onun 4 bölü 5'ini almadın.
Guys, length to width ratio. Okay? Percent.
Okay.
So, if the length is 100, the width should be 80. This is what we mean by 80%, right? Now, I have a width which is 11.
Okay.
How much is the length? Okay?
Okay.
So, how much is it?
Multiplied by 80.
No, it's not 11. It's 10.
No.
What she wants is 10.
No,
Wait,
No. I wanted to change the length of the tooth.
Okay, bro. That's what we did in the beginning, 11.
Which is
Evet hocam.
11 multiplied by 100 on 80. That's
Yes,
it?
that's it.
Şunu söyledim.
13.75. So the central incisor, guys, the central incisor length in the ideal situation should be 13.75. 13.75, which means like this. So in this case, what I can do is to elongate the tooth by either crown lengthening or gingivectomy.
Crown. I think.
Yes, here it depends on the biological width. So you have to say to the patient, if you wanted to make your tooth in the perfect way, I have to go either apically and do gingivectomy or crown lengthening, or I can increase the length from the incisal. But here I have to think about what?
The bite.
The bite and the occlusion. So you will determine the occlusion, you will determine the biological width, and you will calculate how much millimeter you will increase and see the perfect option. In this case, let's say I'm happy with the gingival level and the biological width is not allowing me to make any kind of gingivectomy or crown lengthening, and the bite is accepting the elongation of the central incisors, so I will increase the length of the centrals. So this will be 13.75 with the width of 11. What about this one? I want it to be exactly the same. Here the length is 10, so I will increase it incisally like the other tooth. What about the width?
What we said it was 8, we should make it 11.
Yes, now it is 8, we should make it 11. I have to calculate here.
That's 1.
It's 1, here it's almost 1, so I need more 1 millimeter. How can I behave in this case?
We should reduce the other piece to 10.
We can split the 1 millimeter between the two teeth. So it will be like 10.5, 10.5, and accordingly, how much gonna be the length?
13.7.
Less. It's gonna be less than
13 falan.
13, like 13.
Oh,
Okay? So it's a matter of
ratio.
ratio. You should keep this ratio. So if I made Here is the first central incisor. Here is the second one. 80%. 80%. Here I have 11 to 10. Here I have 10 to 8. Right? Now I wanted to split this space to be in its ideal situation. So this will be 10 and a half. This will be 10 and a half width. And the length should be 13, 13. Okay? This is the goal. How can I achieve that? We can first take impression, send it to the lab. The lab will make the mock-up from the wax. Send it to you back. You will take impression, the silicone index, and work on the patient's mouth. Or you can do it freehand because the patient has no time and you will do it now. So you can do it with the composites roughly, take the impression, then do the permanent composite. Okay, understood? Now we will do it roughly. I need some water. I said like I have to reduce about 0.5 millimeter from this tooth. I will do the reduction first.
Hocam mesela burada santral ve santralin diastemasını yaptık ya. Santral ve lateral diasteması olsa nasıl yapacağız? Yani aynı oranı.
1.6, here it's 1. Around 80%, here it's 70.
Tamam.
Okay?
Central, lateral, 70.
Ne oluyor ya? Okay. Okay, now, so I took like 0.5 millimeter from the right central incisor. Okay, now it's 10.5. Then my middle line will be exactly here, okay? So I will roughly add composites
So Professor, we start first mesiodistally.
here I'm doing just the mock-up
Oh, okay.
because I will explain something about the mock-up, okay? Okay, I added mesial, now I will add the distal because I said I will make it like Okay. Tamam, light cure. Now I want to show you something. Now just we increase the width, and you will see how much ugly the tooth if it is very wide. That's why we should keep the proportions. An aesthetic result? No. So we need to increase the length by 2 millimeters.
2, 3.
It's now 3 millimeters. Okay.
Hocam bu sizlere yapılan kompozitler ne kadar süre az içinde kalabiliyor? Sürekli kullanıldığı için çabucak mesela düşme gibi şeyler olmaz mı? Ya da kırılma.
Retention according to the occlusion and according to how much you do bevel, the kind of adhesive you are using.
But doctor, on the jaw you're working on, increasing the length will ruin the occlusion, right?
That's why I said we have to
Increase the width.
check the bite before we take the decision, right?
Yeah,
So if it is not allowing to increase the length,
we can.
you should avoid it. Yes, you should go for apical decision, apical reduction, which is crown lengthening or gingivectomy. Okay?
Professor, can
Okay.
can a diastema be cured like normally with the eruption of a third molar, perhaps?
No, because this has limitation in time. Okay. Now I increased the width and the length for this central incisor. Why I'm showing that? Because you will see a lot of patients coming to the clinic. They had previous diastema treatment and closure, and they are not satisfied. Because diastema does not mean that you should add some composite to the distal and the mesial and close the space. It means to create an aesthetic result that can make the patient more satisfied about his teeth. Look at the difference now. Which one is more aesthetic and more acceptable?
Right.
The right one. And you can do this in the patient's mouth and say, look, if you have to give this result, I have to do this and this for you. If you are satisfied with this result, I can just add little composite, and sometimes we don't close the diastema completely. We just reduce the diastema to make more acceptable appearance, and this is kind of camouflage treatment. Who gonna take the decision? The patient. And what is the accepted for the patient could be accepted for you. Okay? So this is our mock-up. I will continue with the second tooth, but we don't have silicone here, so I cannot take impression, right? Var mı?
Protezde
Var mı?
aldık. Bizim silikonlarımız mı?
Var mı?
Sordum. Vesaire.
Evet evet.
Asya dolaplar getireyim mi?
Getir. Okay, şimdi bunu da uzatıyorum. I will increase the length of this one. And then you will do adjustment, the same length, same width for both teeth. Okay?
مكتوب تقدر ترجع لقدام شوي.
Kurşun kalem var mı?
Bu yapar.
Okay. So again, mavi bir tane vardı ya elimde. I will check. Now it's 13. Here's the width. 10
About 10, yeah.
and half. Now the length. I have to reduce this little bit. And here the width is more. I have to do some reduction here. Okay? Then I will determine where are the transitional lines. Here is the zenith point. Here is the zenith point, which is the highest point in the central incisor. Here is the distal transitional line. Here is the mesial transitional line. So this should be in parallel with it. Okay? Then the teeth gonna be similar. Bu neden böyle ya? Okay. Then I will take an impression. Now I mix it. Then I will take impression. Okay? This is what you see on Instagram, right? We will wait for the material for the sitting. We have to wait.
Sonra da koyarız. Pardon.
This is translucent.
I mean, we're doing on elements. So
Hocam bir şey sorabilir miyim? Sıvı olan kompozitlerin neydi?
Alayım bir tane varsa. Getir. Getir.
Hocam tamam.
Now I have an index. I have a reference. So I can use this reference to make my permanent restoration. Okay? This is what we call by silicon index. Now I will remove the previous composite. Usually I should be able to remove it. Tamam. Okay. Okay, so now I removed all the mock-up composite. How can I prepare the enamel surface for composite restoration? I should do beveling. What do we mean by beveling? Removing the superficial hypermineralized area, because this area, as it is strong, as it is rich with the strong fluoroapatites, it will resist the acid etching. So I need to decrease this area, and I will do beveling. Usually how we do beveling? With needle form burr. It could be green, blue, whatever you have. All the approximal surface, little bit the incisal because I will add there, the distal surface, I will remove the rest of the the other two, the same. Beveling. اقسم بالله انا خايفة. başka bir aeratör alabilir miyim؟ 100% هنعمل احلى. انا هذاك عملته لف هيك حيلا. هنستعمل ماتريكس. Yes, thank you. So I will do beveling, beveling, beveling. Why I'm doing beveling now? Why I'm doing beveling?
Just like you said, to remove the interproximal area.
Yes. Okay. Now I removed all the composite, the previous composite, mock-up composite, and I did beveling. Beveling to the surfaces that I will add composite. I will add here, I will add here, here, and here to the incisal, okay? Look now. Guys, look now. You have a sharp edge here. And we said, like in dentistry, we don't like sharp edges. So what I will do? Roundation. Okay. Now I checked all the surfaces. They are clean and ready for etching. Now again I will check with my silicone index. Look at the silicone index here. Here is the midline. Here is the incisal edge. Here is the distal wall. Here is the distal wall. Okay? So according to the silicone index, here it means that I will increase the length of the tooth incisally. Here I don't need to add anything because it's almost on the midline. On the other tooth, I will add mesial, distal, and incisal. So I can see where to add the composite. I should keep drying. I wanted to see chalky appearance. Then we will add the bond. Can you see the difference in the color of the tooth surface now after etching?
It's yellowish and
And yes, now after the bond it starts to be smooth and shiny. Drying until nothing is moving. Then the second layer.
shiny. Again, doctor, why a second layer?
Because this is self-etch adhesive, and in the self-etch adhesive we need to decrease the hydrolysis effect to the maximum. Okay, now light cure. Okay, the other tooth.
Professor, I just have a normal question. If it's not perfectly made, it wouldn't matter because I'm gonna cover it up, right? If the tooth is not perfectly beveled and lightened, and
I will cover. Yes, I will cover it, and I can change even the shape by doing veneering with composite. You can change the shape. You can do anything.
What
you
I'm
want.
asking is, it wouldn't matter if it's not that perfect in this stage, because I'm going to
Yes.
cover up. Okay.
Yes.
Well, the colors are 50. The face is 50.
diş kesiyorsun.
Okay, now this is ready. Now we will apply the composite, the incisal portion of the composite on the silicone itself. Then we will place it here. In order to understand the extension I need to add, I can make like this line with the prop. Okay, so I need, let's say this is my enamel composite, which is translucent composite. Then here is the first.
I'm filming for the group, bro.
Yani böyle yapalım.
من بين الدنيا كلها مليت غير هون. حاول كمان.
Incisal, medial, incisal, and distal on the OT. Now I can start layering the composite. I will not talk much about layering because you didn't learn yet about the properties of each type of composite. But let's say now I have like the borders, so I will fill it with the composite. Okay? You should do the condensation.
Hem hasta için hem yabancı için.
Hastasının kardeşinse kesecek misin dişini?
Bir eline ışınlıyorsun yani.
Ama istiyorsa
Kardeşimizi keserim hocam.
Senin pegilateralin var ya, onu kestirecek misin yoksa
Benim
kompozit mi?
peglaterelim mi?
Var. Evet,
Kestirmeyeceğim hocam.
keseceksin. Kesilmeyecek. Kompozit yapılır o zaman.
Çok tatlı.
Şimdi anladım. Sen yüzüne hiç bakmıyorsun aynada o zaman.
Hocam pek beklerken tatlı bence.
Birisinde şey yoktu hocam, laterali direkt yoktu. Sınıfta birisi.
Tamam. Şimdi ne yapacağız? Bunları dolduruyoruz. Ama önce bir kama alabilir miyim? Wedge alabilir miyim? I need wedge.
Hocam layering öğrenecek miyiz bu sene? Layering yapmayı öğrenecek miyiz?
Yok ya, seneye ya da 5. sınıfta öğretiriz.
Benim laterallerim karakteristik abi.
Sonra kırılmasın.
Dur gel.
Elin temiz mi?
Temiz temiz. Şimdi tak.
ايش يعني؟ ايش يعني؟ قصدك اي procedure منهم؟
هذا اللي نسوينه هسه.
انا بعلمك anterior composite, aesthetic composite. Diastema closure, veneers.
اسمه Diastema closure بس. اريد هم اضاء عليه بدون تتعلم. كل Diastema closure نفس البروسيجر.
لا حسب الحجم والاسنان شرحنا، ما كنتش تسمع؟
لا بالي كنت اسمع بس يعني هذا اللي انت تسويه مثلا بالفلو بالكومبوزيت وهذا.
Yes, you can use
كله
it.
نفس الشيء.
Yes, yes. Bir de buna da açayım. Okay.
هذا الشفاف ليش تحطينه؟ انا مو شو اسمه يعني
Matrix.
shape يعني هذا ماتريكس.
Matrix.
What's the name in English of this?
Matrix.
Translucent.
Translucent cellulose strip.
Olmuyor.
Okay, tamam.
Hocam kamera rahatsız ediyor mu sizi?
Tam başım üstüne. Hareket edemiyorum.
Gözükmüyordu kameradan.
Şu an biraz
Okay.
ama düşüyor hemen.
Yes, okay. Now şöyle yapabiliriz. Okay. Guys, now I put the matrix and now I have the palatinations. I will use the wedges in the embrasure. Tweezer. It's okay. Okay. Now I can start putting the layers on the second tooth.
دكتور انت تحطين على البكت شوف
طلع بالضبط.
Flowable no. It's a composite type, flowable composite. I think it's for better adaptation. Hocam flowable composite yani kullanma sebebimiz daha akışkan
Aproksimal
olduğu,
bölgelerde daha kolay.
akışkan olduğu için
Bir
daha
de
iyi dolduruyor.
sonra ben Ben bunu buraya bir de mekanikal özellikleri orada çok fazla etkileyemez. İnsizal bölge gibi değil. مش عم بخلطهم انا بس عم بنظف الآلة تبعتي. عم بنظف فيها.
Avantaj için şey sayabilir miyiz hocam? Hani oradaki alanları daha iyi doldurduğu için mi kullanıyoruz?
Daha kolay kullanılabilir. Bu kadar. Ama mekanikal özellikleri zaten etkileyemez aproksimal bölge. İnsizal bölgede ben akışkan kullanmayı sevmiyorum. Çünkü insizal çok kuvvet kullanması gereken bir bölge.
Sadece aproksimal yüzeylerde.
Aynen.
Hocam peki normalde kompozit şekillendirirken şu an yaptığınız gibi flowable kompozitten ve böyle
Ben flowable kompozit el aleti temizlemek için kullanıyorum çünkü yapışıyor.
sticky and instrument interface.
That's right.
دكتورة يعني نقدر نحط غير نوع كومبوست هنا ولا لازم يكون هذا الشكل؟
يعني ممكن تستعمل كومبوزيت اللي معك عادي. الفكرة انك تتعلم شوية تعمل سيليكون اندكس.
بس المهم انه يعني ينطينا هذا الشكل من فوق
يس.
حسب
بالضبط. يس.
focus on this.
Guys. Ben burada şey temizliyorum el aletini. Yapışıyor.
nasıl temiz
Hey, can بعملها. I'm cleaning the hand instrument. Or you have, if you have alcohol, you can clean it with alcohol.
So you're using your finger to put pressure on it?
Just to stabilize. Can you see, guys?
دكتور اذا طلع البلك من السن شوي اكبر من السن الثاني
We can remove it.
نشيله بالكامل ولا نشيله بالبير يعني مثلا؟
بالبر.
بالبير.
Yes. Okay, now I think I should increase the bulkness here on the incisal edge mesially. So I will add more composite.
Bu hani shield oluşturduk dediniz ya platal shield. Bunu mesela en arkaya koyduktan sonra mesela porlu kompozite iç katmanlardan bir yerlere koyabiliyor muyuz?
Koyabilirsin.
Çünkü oraya zaten kırılma, oklüzyon kuvveti gelmiyor.
And guys, keep in mind that you can add more composite because you can do reduction as you want, but don't finish your work with underfilled restoration, okay? Reduction is easier than adding.
Sir, can you please go back a bit? Thank you.
Okay, this is the end.
Going to be the same from under.
Yes. The principle is the same.
Okay. Details of it.
Okay, no, I have to make it more easier. Okay. Here is the round, round, round, round. The incisal edge. Okay. So okay.
Şekillendirirken estetik açıdan nasıl bir değişim oluyor? Çizgileri çizdiniz ya, görsel olarak mı tamamen çiziyorsunuz? Bunları daraltma, nasıl
Tam
değiştiriyor?
ışıkları durması gereken bölgeler için wavelength, anatomical features her şey değiştiriyor. O yüzden onlara göre reduction yapılıyor. Bak. Şu anda aslında ben hala bunları kapatmışım ama reduction yaptım ya, sen daha dar görüyorsun dişi.
Aslında aynı bu. Sadece yansıma gibi. Mesela bir de şeyini kullanabiliriz değil mi?
Zaten disk kullanacağım şimdi. Lingual'dan tabii lingual'de normalde hangi frez kullanıyoruz? Needle ve yes. Now I can move to the disk. I can move to the disk and do what I teach you last time. You will use the disk to finish the approximal finishing lines, the grooves here, okay, and the incisal edges. Okay? What do you think?
Wow.
Lebanese guy. Typical Lebanese guy. Okay? Start. Yes. The central incisor, let's say